Well, good afternoon, everyone. My name is Carrie Robertson, and I am absolutely thrilled that you're here today. This is going to be a little different presentation. It is a LifeWave X39 presentation that we actually have three different medical professionals on here today to share with you, what they love about LifeWave, how they have been able to process the research, the studies, and why they're passionate about it as well. So I want to bring them on and let them introduce themselves, give you a little bit of information about who they are, their education, their background, and then we're going to get into a great conversation here today. So, why don't we start with Dr. Don Verhulst? If you would jump in here and share a little bit.
Yes, thank you for having me today. I am an MD and I have been for 40 years. And what I do is natural alternatives. I help people get off pharmaceuticals when it's possible and prudent, and it's not always. But that's what I've been doing, helping people detoxify their body, balance their blood and immune system. And when I first heard about the patching technology, I had never heard the term photobiomodulation. I was familiar with light therapy, which is being used everywhere, all over the world, and in hospitals and by doctors, all different types of uh, light therapy. It's well accepted and well studied, but I'd never heard of that. And my wife really came to me and was excited because friends of ours were getting tremendous success with patches. And she said, I want to start patching. And I was not an early adopter. It sounded crazy to me. I was highly skeptical. And I said, I'm not going to tell people to put a patch on them and they'll be healed. I was born at night, but not last night. It just didn't seem like any science at all. And then she said, there are clinical studies. Well, I agreed to look at those, but not really to verify that this patch worked, but mainly to prove to her that there wasn't any good science behind it. When I did, I found a tremendous number of studies, and they were studies that I was used to looking at from my science background. They were double blind, they were placebo controlled, they were independent, not done by LifeWave, done independently. And some of them done at the #2 master regenerating cell research facility in the world in the University of Ireland. That was impressive. But probably most impressive was many of them were peer reviewed. That means you do your study, you make your conclusion, and then you turn it over to your equally qualified peers and say, is my study valid? So when I read all these, I saw that there was powerful science behind this. And that was very impressive to me. But still, I wanted to know, is it safe? And I was certainly, that was verified because it's non-transdermal. And to me, a patch was, a nicotine patch, an estrogen patch, the chemicals on the patch, it goes in your body and does its job. I was told no chemicals were passing through. Well, then how does it work? It just uses your body, your infrared heat energy, your 98.6, if you will, to activate the patch media. In the center of the patch are organic amino acids and electrolytes in a microcrystalline stereoisomer. Very important, that configuration, because when infrared energy hits that, it forms a very specific wavelength of light that is then shined into the body. So really your body is just your own body heat. Your infrared is the battery, the energy source. It's that specific light wave that going into your body makes the difference and is clinically studied to with the X39 that we're talking about, which is our flagship product. I think everyone should be using it. Increases these master regenerating cells. Most people don't even know you have these cells. This is definitely the greatest breakthrough I've seen in 40 years as an MD in both traditional medicine and in natural alternatives. These master regenerating cells can become anything that your body needs. If you need help in the cardiovascular area, it can become a heart muscle cell. It can become an endothelial cell lining the blood vessel. It can become an immune system cell, a skin cell, a bone cell, a liver cell, whatever you might need help with. And once it becomes that, it stays in that line that type of cell. But your body always retains a number of what we call undifferentiated master regenerating cells. But what most people don't know is by the time you're 35, you've lost about, the average person has lost about half of that activity. And by the time they're 65, they've lost 90% of this master regenerating activity. And I think it's the number one reason that people age. So this to me is the reverse aging science of the future. Certainly, I believe it's the preventative medicine of the future. And of course, we don't make medical claims for patches. We don't diagnose or treat sickness and disease. I'm a doctor. There's other doctors on today with us, but we're not your doctor. In fact, I recommend people bring this to your doctor and ask them about it. If they'll look at it with an open mind, they'll find these tremendous studies and a mountain of science behind it. So I became very passionate about it. About 3 years ago, I started using this. I've never done anything that's had this kind of impact on people's health. And I will give the credit to this one patch. The X39 is the standout patch. It is absolutely life-changing. But if you run into people who are skeptical and don't get it, I think that you're in good company. Be patient with them. Uh, just give them the information they need, send them the resources. The science is there. We've got so many testimonies, before and after pictures, experts, thousands of doctors around the world, like me, MDs, DOs, chiropractors, functional medicine specialists, and naturopaths that are using this very successfully. So I tell people the patches are not on trial. The patches work. What's on trial is you wearing them consistently. But the biggest challenge with patching is to keep people wearing them consistently until they notice something. But that doesn't mean it's not working. By the way, you didn't feel your blood pressure or blood sugar changing, but both of them have, even since you've been listening to me. So just because you don't feel something doesn't mean it's not happening in your body. And we can measure your biological age, and we can have you patch, and we can remeasure that and see the benefits. And some of the studies are just phenomenal that are out there. So the idea is getting people to put this patch on and to be educating them that it takes 3 to 6 weeks for 80% of people to notice something significant. What I've noticed in probably patching clearly over 1,000 people personally in the last 3 years, I hear most consistently higher energy levels and better sleeping. But less pain and inflammation are also common, clearer, more focused thinking, just a general sense of well-being, certainly improved wound healing, GI improvements, things like that is what I hear most commonly. But it's 3 to 6 weeks for 80% of people. 10% of people are quicker than that. We love that. One patch wonders, 1 day, 1 week. We've got many testimonies like that, but they're rare. And just like on the other side, 10% will take longer than that, up to a month for every decade of life. So educate people about it. But the important thing is to get this patch on. 12 hours on of activation, take it off and throw it away. There's about enough energy left in it for a dog or cat, and it does work on them. And then 12 hours of rest and restoration so your body doesn't acclimate to it. So you get a full benefit when you put that patch on the next day, 7 days a week. It's that simple. It is definitely effective. Patches aren't on trial. We've got the studies, we've got good science. And the more someone wants to look into that, the more they'll find that it's there. It is effectable, it is safe, it doesn't interfere because it's non-chemical. It's light therapy, doesn't interfere with pharmaceuticals you might be on, over-the-counter medications, vitamins, minerals, herbs, perfectly safe. So that's a big benefit of it too. And you really don't have to figure out what's going on with the person. It makes my job a lot easier because it's smart technology. It goes and works on the most important area first, then goes to the next one, then to the next one. How does it do all this? Because it's not doing anything new that your body hasn't been doing your whole life. It's just that you aren't doing it as effectively as you were because you've lost 50% by the time you're 35, 90% by the time you're 65. And although it sounds kind of futuristic and paradigm shift, and in a way it is as ancient as life itself because photobiomodulation is light therapy in its simplest form is just the sunlight hitting your skin and making vitamin D. That's photo, light, bio, the body, modulation, changing the body with light. That's what this patch is doing. But the sun's, millions of miles away, and it's the full spectrum, all wavelengths of light, infrared and ultraviolet included. And this is a very specific wavelength of light, and we've got clinically verifiable benefits with it. So if people, no matter, even if they don't have anything going on in their body, they just want to prevent sickness and disease or reverse aging, that's my starting point with people. I've never worked with anything like it. And I'm happy to talk with anyone about it that wants to share. I'm much more passionate now that I've seen what it can do for people's lives. And I love the X39 Master Rejuvenating Cell Enhancing Patch to turn back the hands of time.
I love that. Wow, that was really incredible because it truly is all the things you said it was. And so stand by. We're going to come back to you in a minute with a couple more questions, but let's go to Rachel Maurice, MD, and let her share a little bit about her background, education, and what brought you to trust the science and know about it.
All right. Thank you so much for having me and for everyone here listening. So my background is that I worked as an anesthesiologist in Canada for close to 20 years. So my background is such that I was very steeped in conventional medicine until about 2017. So I went straight through all of my schooling. I did an undergraduate Bachelor of Science in microbiology and immunology, went right to medical school at the University of British Columbia, and then my residency for 5 years in the University of Alberta, which is in Edmonton. So I finished at 30, spent 20 years as an anesthesiologist, and really it was in 2017 when my mother was diagnosed with uterine cancer that I started to look outside of it. And I bring this up and it's relevant just because I have had the very concrete mindset that a lot of conventional doctors still do to this day. And so I'm bringing that up to share that my mind has been changed. And what ended up happening with the introduction in 2017, I started looking about nutrition, which is not something that we're taught to this day in medical schools. At least I can speak for Canada. And I ended up learning more about how the body, the connection between the energetic aspect of the body, which is a real thing, but very overlooked in medicine therapeutically. It is used diagnostically, which we know about, for example, with ECGs and EEGs, where they monitor the electrical activity of the heart and the brain and muscles. So energy is there. It's just really not, it's overlooked. So in 2020, things started unraveling in a way that made no sense to me. I was being asked to do things that were completely different from the previous 30 years and how I practiced. And I stepped away in 2021 from my clinical practice and started doing a lot more research and investigation in all of this information that I was not taught, and uncovering studies and research that was already there, which led me to understanding a new paradigm of how the body works. And by that, what I was taught was about something which is now termed quantum biology. Now, it's different from other quantum modalities that people might have heard about. This is how the body works on a subatomic level, which starts with light. So while the old model or the medical model that we still use today, the premise is that the body runs on biochemistry, but really in reality, upstream from all of that biochemistry is light. So I started doing a very deep dive into light for about 2 years, learning again about photobiomodulation. Yes, it is old as time, old as the sun, but we have in this new scientific era termed this photobiomodulation probably for the last, it's been about 3 decades maybe. It's just a scientific term for phototherapy. And there are over 6,000 studies in the scientific repository, at least PubMed. So the last I heard it was 10,000, but to err on the conservative side, it's 6,000. So it is a documented, verified science. It is not fringe. It is not questionable. It is it's absolutely verified. So in that, I started learning about mitochondria, which people might glaze over at that term, but you may have remember back to high school about them being the powerhouses of the cell. They are the energy factories in our bodies. And while we did learn a very small part of the mitochondria and their function in medical school, again, that is 30 years ago for me. But to this day, I still was in a teaching hospital where I would ask questions of the medical students and residents that came through. The mitochondria are so much more, but the difference between us being alive and not are the fact that we produce energy. As Dr. Don talked about, the energy, part of that is the infrared light, infrared heat. We can use that interchangeably, which is what powers these patches. And so the mitochondria, where I get into explaining to people, is Dr. Douglas Wallace, who is one of the leading researchers in the world on mitochondrial function, has come out in saying that with his research, at least 85% of chronic diseases stem from mitochondrial dysfunction. 85%. It's not that there are genetic issues. We know now that it is environmental triggers. And I say this because we can have up to 70% dysfunctional mitochondria in our cells without having any symptoms. We can think we are completely healthy, but have 70% dysfunctional mitochondria. Once we cross that threshold, we get to experience symptoms. Once we go beyond 80%, we are then usually labeled with some disease that the medical system has come up with. So I digressed a little bit, but I feel that it was important to share that as one of the questions that are going to come up later on, I know, in terms of who should be using these patches. But I ended up coming across them in a very timely manner because my mom's health was starting to decline, where her doctors were talking about heart surgery. Having spent 25 years in the operating room, I did not want my mom to have any heart surgery, any loved ones. And it's not that there is necessarily anything wrong with surgeries that are necessary. But again, the nature of intervention, especially when it is invasive, there is just the potential for complications. And I've seen a lot of complications. I will say this actually, because I think it's relevant, that the research, the data that's out there, and this is not hidden. This is very well known in medicine that the third leading cause of death in North America is medical intervention. So I did not want my mom to have surgery. We came across Diane Hunt, who showed and introduced me to these patches, was a cardiac surgical nurse for 20 years. And I understood the science already about photobiomodulation. She shared not just stories with me, but investigations such as echocardiograms, which are ultrasounds of the heart, electrocardiograms, which show the electrical activity of the heart, of people who had been in heart failure, which was my mom's biggest problem, after wearing these patches for 8, 10, 12 months, no longer being in heart failure, but significantly, not just small improvements from 15, 20% ejection fractions to 40, 50, 60%. I've never seen that in my career without an artificial device being implanted. Diane Hunt had never seen that in her 20 years in the cardiac surgical suite. So this was an absolute no-brainer to me. We got started and I prepared my mom to have patience. As I alluded to, we can live with up to 70% dysfunctional mitochondria in our cells without knowing, which means we can think we're healthy, but it's like an iceberg until the iceberg crests through the top layer of the water, the ocean, the whatever layer it is. We don't know what's going on beneath the surface. It takes decades to get sick. So it's going to take time for healing to happen. And I think that's one of the issues that a lot of people don't understand. We've just been conditioned in society to want to hit the easy button, have overnight changes, immediate success. And so I have to say that I was extremely shocked when within 2 weeks, my mom went from having to stop every 2 to 3 steps to catch her breath from her heart failure and the fluid being in her lungs to walking with me for 20 to 30 minutes on an incline while talking at the same time. And then 3 weeks later, having to have her thyroid medication lowered that she had been on for over 30 years. So this is something that I became very excited about, started sharing, started seeing miracles with everyone I was sharing with. Again, as Dr. Dawn said, there is no risk, there is no reason not to give this a try. And I can tell you from what I have seen, and I know my view is skewed working in the hospital, seeing a lot of really ill patients, that I have never seen anything like this in 30 years I've been in medicine. I did not see healing from chronic diseases. I saw at best the delay of the progression of disease, and at worst, a whole lot more harm. There is no harm to using these patches.
Wow. Thank you so much. I'm sitting here thinking, both of you talking, like there's so much we could talk into this, but we're going to come back. So we'll put a pin in that for a second. All right, let's go to Dr. Larry Prasant. And if you would jump in here and share with us a little bit about your background, education, and what brought you to LifeWave.
Well, about 40 years ago, I completed my surgery residency in Cleveland, Ohio. And for the past 28 years, I've subspecialized in the treatment of varicose veins. That naturally led to an aesthetic facet of my practice where we had incorporated light and laser therapy for patients. And so when I heard about the X39 patch and about the phototherapy concept, I was very receptive and somewhat familiar with it. And the more research that I did on this, I found out that not only does the body emit light in the form of heat, but the body also has receptors to light, especially on the skin and through the eyes. And so we have evolved, over the millennia to receive this type of energy, and it has a positive and beneficial effect to the body in many different ways. And the more research I did, delving into this, looking at the decades of research on red and infrared light by Dr. Hamblin at Harvard, the more fascinated I became with this whole concept. And I started incorporating this into my practice with great success. And the thing that really intrigues me is that you really never know what the benefits are going to be. Everybody benefits differently, and it has to do with epigenetics, which is the way that our DNA is being expressed. And this is influenced by many factors, whether they're environmental or lifestyle changes that we all differently incorporate in our lives. Um, but my experience with this has been absolutely, unbelievably incredible. I've seen some miraculous results in different patients. And so I just can't uh, stop recommending it to just about everybody. Everybody can use this type of therapy. And the genius of it is where the inventor has shrunk down this form of light-based therapy into a inconspicuous wearable patch that's easy to use. It's an affordable treatment, and there's really no reason why everybody shouldn't benefit from it.
That's so good. So tell me a little bit about personal use and family and what really was the wow factor for you.
Well, we were told about this patch almost 3 years ago, and we started wearing it with really no expectations at all. One of the things that my wife and I first noticed was just better mental clarity and decreased brain fog coming off of COVID. And we slept better. We just felt better in general. One of the unexpected things that we experienced is that my wife suffered from an inflammatory um GI condition, which was very, very serious, and no medication seemed to help it at all. And after wearing the patch for just about 3 months, her doctor said that her condition went into complete remission, and it stayed in complete remission for the past 2 years. And he just couldn't wrap his head around it since he's, one of these big pharma guys. Um, but even the anesthesiologist noted that he's been following her case, and they just don't see anything like this. And they do thousands and thousands of colonoscopy treatments and follow patients with this particular condition. So it's very rare for this type of improvement, and I consider it a miracle.
Absolutely. Well, I absolutely love that. All right, so I'm going to come back and forth. We're going to ask a couple of questions because there's no doubt there's so much wisdom. I'm just sitting here thinking, wow, 30, 40 plus years for each of you. It's pretty incredible from the medical standpoint. So let me ask this. Every now and then we get a little bit of pushback from people who say, well, we don't think the clinical studies are big enough, or maybe that, LifeWave paid for the clinical studies, or because not everybody knows how clinical studies get published, obviously, right? So why don't we address that for a second? Dr. Don, you made a point that you said when you wanted to disprove that this would work, and you started diving into those studies, and you found that there were some done, they were peer reviewed, there were different ones. So tell me a little bit about your research there and what you were able to find, and what made that go, wow, this is something that whenever you were like, no, I'm going to prove that it's not. So share
Yeah,
that.
I think it's a valid concern. It's a great question. I love being questioned about things like that because that's what I was doing in the beginning. And of course, we'd like to see studies with, 50, 100, 150 people. They're a little more credible. But just because a study is small does not mean that it's not well done and not significant. Usually we start with a small study, and then when we have a finding, we do a bigger study, and LifeWave has done this and continues to do this as well. But there are a lot of studies that are very adequate in numbers. Of course, there are smaller studies, but they lead us to the bigger studies, and also they have validity in and of themselves. If they're well done studies, that's, even if it's 16, 20 people, that can be some life-changing things. So it's the quality of the study that I was impressed with. In my realm, I'm an MD, but I don't use pharmaceuticals. I help people get off when they can using vitamins, minerals, and herbs. And I have seen companies in the past do their own studies, which is not what we have here. These are independent studies. But when a company does their own studies, they might do 10 studies on their product, and nine of them might not be beneficial, but one seems to be a little bit beneficial. You see that one, you don't see the other nine. That's not good science. And that does happen out there in the industry, especially in the natural alternative industry where where there isn't lots of money for the research. But these are not. These are valid studies. As I said, double blind, placebo controlled, independent, and then some of them peer reviewed. So size it does matter in the sense that when we do bigger studies, it's more validity there, but it doesn't mean a small study isn't valid. We've learned some tremendous things that are then verified by the numbers of people using the patches, and that you can't refute. There are millions of people worldwide that have a story. They had something, they started patching, and here's what happened. And of course, we don't uh, say the patches even did it. We say the patches support all the organ systems in the body and their ability to get and stay healthy.
That's really good. So we're going to come back to some of those questions, but Dr. Priest, something that you said that I really want you to maybe elaborate on. is, or maybe you didn't say it, maybe Dr. Don said it, but I think this is good because a lot of people don't really understand how much phototherapy is used in all types of medicine. You know, they just don't see it labeled as phototherapy, but it's dermatology, it's oncology, it's all the things, right? Including newborn babies. And so, can you elaborate a little bit on that and how that you see the benefits here, being that it's easy enough just to pill and stick every day and people can benefit from it?
Well, most people are familiar, some aren't, with different forms of phototherapy. I mean, the simplest one is just taking a walk in the sun and having your skin manufacture vitamin D. For certain newborns that have jaundice, they put them under a specific wavelength of light to help them clear the bilirubin out of the skin. Um, uh, Various other forms of light-based therapy are being used for the eye and different eye disorders with red and infrared light. Um, so it's becoming more and more utilized in medicine. Uh, and um, it's probably something that's been being done for millennia. It's just that we've ignored it for so many years. And just now, some of the recent research is bolstering an increased interest in this type of therapy. This therapy is extremely um, beneficial in many different ways. And we really don't know exactly how the body's going to respond. As I mentioned before with epigenetics, okay, this therapy is not altering your DNA, but it's changing the way that the DNA codes for different proteins. As our genes signal each other and talk to each other and decide what needs to be done in the body is really being assisted in various ways to heal itself, which is magnificent. The problem with mainstream medicine is that we're really treating symptoms. We're really not curing very much. Maybe antibiotics will cure infections and maybe some other limited forms of pills will be beneficial, but we're just controlling and muting symptoms. So to really assist the body in healing itself is, I think, a really higher plane of medicine and in ways to treat the body and various ailments. It's it's very sophisticated yet very simple in the concept, and we don't really understand the exact mechanisms, but we're doing various forms of research, in order to learn, about how different forms of red and infrared light affect the cytochrome C oxidase system in the mitochondria. There's also other mechanisms that are being incorporated in this. And, basically light therapy is the essence of light. We live off of the energy that's stored in plants, and that energy comes from the sun. Plants have chlorophyll, and they store this energy, in the form of sugars and starches. And so when animals consume these plants, they're benefiting from this stored energy. So energy really is the source of light. And, why not use it, with something that's so simple, and so easy and so inexpensive, um, in order to derive whatever benefits our bodies need.
Yeah, that's awesome. So one more thing from you real quick. What would you say that you saw that literally the valid research whenever you could look at the clinical studies? What was it that stood out to you?
Well, in looking at the studies, I delved into all the research and especially the PubMed articles, that are available. And um, so many different things that are happening in the body from nerve regeneration to decreased sensation of pain to inhibition of fibrinogen, which causes blood clots. So there's really kind of an anti-blood clotting effect to this. Um, uh, Increases in various gene expression, which are beneficial for the body, waking up our dormant stem cells. As we age, our stem cells decrease in activity. So basically, when you're my age, pretty much most of the remaining stem cells are manufacturing blood cells in the bone marrow. So, uh, who are the people that get most of the deleterious effects of aging and cancers? They're people who are older. And these healing mechanisms of the body are basically going to sleep and becoming dormant. So, in order to wake these systems up, with a very, very simple therapy is really miraculous. And so I don't see any reason why everyone shouldn't at least try this therapy. I think it's important to stay on this therapy. I mean, you wouldn't stop sleeping, you wouldn't stop eating food. This is really important for life and the quality of life. And I think there's no reason for people to suffer unnecessarily when there's just such a simple aid out there that they can avail themselves of.
Yes, absolutely. I agree. I love that. All right, Rachel, let's go to you for a second. You said something that was really key, and I want to hear your take on the clinical studies as well, what you believe and what you saw there, but you also said something about that the tip of the iceberg, right? And I think about that often because we hear people say, "Oh, I wouldn't need to wear it because I'm perfectly healthy." And or we see people that say, "But I'm too far gone, and so it wouldn't help me." And so, what would yours, as you're talking about the clinical studies as well, what would your take be on that?
So it's an interesting question because I did throughout my entire career, I heard many patients say I was completely healthy until 20 years. I didn't see a doctor for 20 years, but I say this because we, I believe we all should be wearing these patches in the world that we are living in now. Yes, there are so many people that say to me, I want to do everything naturally. I don't want to use any medication, any supplements, etc. But the world that we're living in today is not the world that our bodies have evolved to ideally and optimally run on. We have so many more toxins in our water, in our air, in our food, the electromagnetic frequencies that are non-native, that our body is not used to. We are under assault on a daily basis, and our body needs the support. So while I personally would like to do everything naturally, this is the most natural way that I can support my body and share with others to do that, rather than taking something exogenous, something from the outside, causing an imbalance, and then your body is then trying to adapt. And that's basically what illness is. It's not a failure. It's not that the body is broken. It's the body adapting to the foreign environment that it is trying to keep you alive and sustain life. And so that's really where the breakdown occurs. And there is a lot more breakdown happening than repair. And we talked about energy as well, right? We have about 100,000, roughly 100,000 reactions going on in every cell, every second of the day. That requires energy. It requires exquisite timing for our bodies to know what time of day it is, which comes from light as well, which is another topic I love about circadian rhythms and aligning with circadian lifestyle for optimal functioning. But we need extra energy for healing. And so, as was talked about, Dr. Prasad talked about red light therapy and targeting specific parts of the electron, what's called the electron transport chain in the mitochondria for people that are more scientifically oriented. The infrared light specifically targets and signals an increase in energy production, increase in ATP production, increase in metabolic water, which is vitally important, and it's not taught at all in medicine. We have a different form of water that's inside the body, which gives us, it supplies us with energy. It helps with the entire electron transport chain, which improves mitochondrial function, which helps that energy to go wherever it is needed for healing. And that also has been talked about. Really, we don't know what's going on in everyone's body. everyone's different. I share with people, we come with a different set of genetic instructions. We've been alive a different number of years. We've had different environments in terms of how we grew up, whether that's toxic load, exposures to things like mold, emotional traumas, all sorts of different experiences. And so we really don't know what's going to heal first, but it is incredibly important for that time to pass. Again, because it takes time for our bodies to break down. It's going to take time for healing to happen. And sorry, you asked me you asked me
Yeah.
another.
Yeah. No, that was amazing. No, I love that because just everything you talked about, the lack of energy and it's so true. And I think people needed to hear that. The clinical studies, what was it when you looked at them that you knew, okay, this is good, this is valid, and that I can hang my hat on?
Yeah, so clinical studies are an interesting one when you talk to me about them, because going through my training, medical school residency, and throughout work, clinical studies are very manipulated. Generally speaking, the ones that are published, the ones that we rely on in modern medicine, it's called evidence-based medicine. That's really what I grew up in, and where medicine was leaning towards. It's called evidence-based medicine, and what that means is how we treat patients is based on the results of big clinical trials, and they become the guidelines, the protocols. But what they don't take into effect is the fact that everyone is an individual. And so we have become so reliant upon protocols, studies, that yes, it's important to do them. It's important to have big clinical studies. But again, these studies have to be funded by someone. They cost an exorbitant amount of money. So they are often funded by the people who have the money, which are pharmaceutical industries, some kind of the food industry. And those industries also pay for the studies to be published in the big reputable journals, the Lancet, JAMA, the BCMJ. So those studies, as alluded to as well, the ones that are favorable often get published. The ones that are unfavorable are not published. And so I take studies with a grain of salt. I actually don't rely on a lot of studies anymore. But speaking to the point that these studies are smaller with LifeWave, someone has to fund them. And so I believe David Schmidt's done a great job with funding and with the size of the studies. But also, I've got a very good friend, and I didn't ask her beforehand, so I'm not going to mention her name, but I was not a scientist doing any clinical studies or what's called hard science bench work, but she's a PhD in biochemistry and a PhD biophysicist. And I spoke with her about this at length. And so she used to have to get the funding for studies, do the studies, write them up, go through all the rigorous steps towards getting these studies published. And she said the ones that are not funded by the big corporations have to have so much more, they have a stricter set of criteria to actually get these studies published and put into journals. So I would almost say these studies are better quality and have more credibility behind them than the ones that are in these quote unquote highly reputable journals.
Awesome. Thank you. Well, people don't know what they don't know, right? So that was kind of pulling the curtain back and sharing. That's incredible. All right. So, Dr. Don, I'll come back to you for a second. You already said it, but maybe we need to say it one more time, different way. I love the fact that, you mentioned that you don't have to worry about contraindications. You don't have to worry about those things. So just kind of allude to that, to the fact that who X39 is for, the fact that you don't have to worry about those things, and then anything else you'd want to add to that.
Yes, well, that was my biggest concern. As I said, when I did see the studies were real and there was something very beneficial about patching, is it safe? And the fact that it is non-transdermal, it's simply light therapy, and that light's being generated by the heat energy of your body hitting the patch media and then reflected back in your body. And it's the wavelength of light that's doing the work. Because it's light therapy, it is not contraindicated or doesn't interfere with any pharmaceutical someone might be on. And people are on multiple pharmaceuticals many times. That's a big part of my decision-making process. When we're trying certain things, what pharmaceuticals are you on? You literally don't have to ask that question because it's non-chemical. That's how safe it is. But there's over-the-counter medications, as we've heard recently, that can be uh, dangerous as well, but most of them are not. But they won't interfere either because this is non-chemical. Vitamins, minerals, herbs, it doesn't interfere with that. It's light therapy. And the way to verify that is, as we've said many times on this, it is just the same as going out in the sun and having the sunlight hit your skin. But that's all the visible spectrum, and the sun's, millions of miles away. It takes advantage of that phenomena in a very specific way, making a specific wavelength of light that then goes in and targets a molecule. In the case of the X39 master rejuvenating cell patch, it is GHK copper peptide, well studied and actually discovered by Dr. Lauren Picard in 1971. He researched it for, I think, over 50 years until he died, a very healthy, natural oriented guy at about 94. So that's the way it works. And it's not going to interfere with any other things. I don't know of any contraindication to using patches. That's how safe it is. And I think because it's not doing anything novel in your body, it's doing what you've done your whole life. You're just not doing it as effectively. That's the reverse aging component of this. So it is safe, it's effective, and highly affordable for what it does. There's no better value in medicine, I'm convinced, natural or traditional medicine, than, for the price of a cup of coffee, you can put this patch on every day and change your life.
And that's so good. So good. All right, Dr. Priesant, I see you're still here with us. So I'm going to grab you one more time. And, you talked about not only seeing it, but from a vascular surgeon standpoint, knowing that you're using this with patients, you've got the confidence, you're putting it on people. I believe I heard you say a while back, that how many times people have said they're so grateful, for this technology and you sharing it. And so elaborate on that, but also the fact of, if somebody says, I'm not feeling the results yet, there's not visible, what would you say to that person in terms of something they need to do or the longevity of wearing it?
Well, the patch is effective in the majority of individuals, and some people have certain expectations of using the patch. For instance, it's like they would be taking a pain pill and expecting a painful area of the body to be relieved instantaneously. It's really not how these things work. The way they work is that they are uh, helping the body to promote healing mechanisms, reactivating dormant stem cells, and uh, activating certain genes, producing certain proteins, which will assist the body in the healing mechanisms. So these things take time. They're on a microscopic level, and the body kind of knows where it needs to work, and it may do it in a different type of order. We don't feel certain things going on in the body. Um, yeah, you don't feel that you have certain cancers until a tumor forms. Yeah, you don't feel certain aspects of digestion. You don't feel new blood cells being manufactured. You don't feel changes in your bone density. So, for people to have that expectation, I think is inappropriate. And they just need to be educated on that. That when they say, well, I didn't feel anything right away. I mean, these things will take time. A lot of them are very, very subjective. Um, certain people, um, worry about whether these patches, might stimulate something bad going on in the body. In other words, proliferating any early cancers into getting worse. But what they're really doing is they're reactivating and waking up dormant mesenchymal stem cells. And these mesenchymal stem cells are very, very benign. They're not going to go haywire and go out of control, but they're going to be involved in various repair mechanisms in the body. So these things do the work silently. They do them in a coordinated fashion, and patience really is the rule.
Very good. Is there anything that you would add as far as, I've talked to a lot of people and we always are stressing hydration, excuse me, with electrolytes, not just to, I guess people think that cars just run on gasoline. Is what I kind of always go back to. You're drinking water, but that's just like having a glass of water is like putting just gasoline in your car. It takes more fluids than that for a car to run. And so, what would you say as far as proper hydration, just the importance of that, just to see how the body truly responds because the body has what it needs essentially?
Well, the body's approximately 42% water, and we're dealing with light transfer through the skin. And light transfers through moist skin better than it does through dry skin. Um, the skin has about 7 layers to it, and the top layer is composed usually of dead cells, which impairs the transmission of light. So anything that's going to keep that skin nice and moist in terms of adequate hydration is going to make the therapy more successful. Most of the people who claim that they're don't feel that they're getting the results probably are just not using this patch correctly. You know, um, with any type of light therapy, the results increase up to a certain point, and then the results start decreasing. It's not a straight line. So the 12-hour on and 12-hour off recommendation is designed to allow the body a chance to rest and regenerate. And if you go past a certain exposure to different types of light, you're not getting an increased benefit. It may actually be a decreased benefit. So wearing the patch for just 12 hours out of the day is correct and very, very beneficial. And the same thing can be said with hydration.
Very good. Awesome. All right, Dr. Don, any last words you'd want
Yes,
to
I'd like to
say?
comment on that, what you're talking about right there. I think of the patches as a very powerful extra tool in your tool belt, another tool in your tool belt. I've written many books on longevity, and they're all based on the 10 keys that I teach, and made a little song about learn to relax, get to bed on time, and do your exercise, breathe fresh air when the sun's out there, and eat like this little rhyme fruits and vegetables, whole grains, white if you choose meat, drink what you're mostly made of, water makes your health complete. These are 10 pillars of your health. They're not the only things, but they're all extremely important. And now we have another tool that literally enhances all of those things, and all of those things enhance the function of the patch. In other words, drink what you're mostly made of, water. I'm constantly trying to get people to drink half of their weight in pounds in ounces of water, which is difficult to do. But if you're dehydrated, patches won't work as well. They still work. But if you're hydrated, they'll work even better. And if you're dehydrated, you have an even greater need for the patches or exercise. It's a pillar of health, of course. But if you're sedentary and you don't exercise, it takes about 24 hours to move the immune fluids through your body. If you just walk 30 minutes 5 days a week, you move those same immune fluids 3 to 5 times through your body, 3 to 5 times healthier. Now, patches will work if you're not an exerciser, but they work even better if you are. But if you're not, you need them even more. So all of these simple pillars of health are still extremely important, but now we've got another tool that's a booster tool that synergizes with all of these things. And it's why I'm so excited about sharing this with everyone. It's truly life-changing.
That's so good. So good. Rachel, anything you want to add there?
Thank you. I do. I want to add to the hydration part as well, because this is something that I only recently learned in the last few years. And while drinking is part of hydration and we focus on that hydration within the body, actually cellular hydration comes from the water that we make, which comes from our mitochondria. But the hydration aspect for these patches to work ties into the fact that the way light travels in the body and communicates, aside from yes, there's biochemical communication through hormones and neurotransmitters. There's electrical impulses. That's another means of communication. But light within the body, really at light speed, is the primary means of communication. And it actually travels through the water network in the body. And that water network is primarily within all of the fascial network, which again, not something that I was taught in medical school. I spent my career in surgeries watching surgeons just brush aside the connective tissue and all the fascia, right? It wasn't important, but it is so vitally important. And it is important for communication, because communication breakdown is when disease happens. Communication between cells, between organ systems, is how every part of the body knows what's going on, and then it can function optimally. It can give us what's called coherence, right? Harmony. And so the water part, we talk about adding electrolytes, and the electrolytes are also very important, and most people are deficient. And I do know that most medical doctors that I was around did not realize how deficient most people are in magnesium and potassium. And a lot of that has to do with allowing our cells to hold a negative charge. And that is really, again, key. The hydration, those electrolytes, which help hold the charge and hold the water in the body, and is just so very important. But I also just wanted to add one last thing when it comes to the research, because there's such a focus on research, I know, and people, especially when it comes to people who are very scientific, have a scientific background or a medical background. And I think that we have strayed so far in our modern world, especially with medicine, that we've forgotten to look just around us in what works, what we see happening before our eyes, rather than what is going on in a lab, what's taking place on paper. Do we have all of the right studies? Well, if you've got 10 people in front of you where you see changes, but on paper it's saying that this is not possible, why are you going to believe the paper? Right? What did we do before all of this? Before the early 1900s? We've been around for, what is it, over 200,000 years? We knew something.
Yeah. Well, you're right. And I'm kind of like, we are the clinical study. We have all seen the beauty of what happens with people's health and their life whenever they begin to wear this technology. And I think it's been said very well. It might not be on day one. It might be, day 90. It might be 6 months down the road. It might be what they said today is that, our health sometimes is like an iceberg, and until it breaks through, you might not know what's happening. There's so many things that, are valid and that we can prove over and over and over. But at the end of the day, it's really, I want you to have the confidence of these medical professionals that as they share this technology, they have that confidence, they have that peace, they know that they're making a valid difference in the world. And, we are just the recipients of David Schmidt's work, because it's changed our life. It's changed my family's life and so many others. And I'm so grateful. And I'm absolutely grateful to all three of you for taking the time out today to share with our team and just in general, the world, what you see here and what's possible and what's taken place and how the body works. Because I think a lot of times people just don't quite understand. It's an amazing machine. And I call this my human light switch. And so when the lights are on, the body's working. It's amazing what's happening. And so I love it. And when it comes to my personal belief and what I share with people is, I get my teeth cleaned twice a year, but I still brush my teeth many times a day. And so we do that for what? Prevention, right? We don't want to get the cavities. So we take good care and we make sure that we have that good dental hygiene. Well, that's what I call this for too, is that, people go, you're still wearing it? It's been over 2.5 years. And I'm like, Yes, because, every single day I feel better than the day before. And the only thing I'm getting old is older, right? Whenever you're getting older and you keep feeling younger, there's something good happening. So I hope this has blessed all of you and that it helps you tremendously out in the field. Thank you so much to all three of you for taking time out of your day, sharing with us, and we are just amazed. Thank you so much. You've shared so much. So I guess that's it. It's a wrap. Thank you guys. We appreciate your help.